So, the quiz is done. Most of all, you did very well. So I'm really happy with that. That means that you've looked at the information and you understand it. Um, I have scored all of your discussion questions already. So I was glad to see, you know, those who've been LPNs or, reading about your life, on them, and why you want to be nurses. I mean, I know since the age of maybe about 5, I wanted to be a nurse, but I was always afraid of a shot, a needle. And the funny part is I became an expert IV starter. I can actually start an IV on a rock. I mean, that's how good I really got. And I know that my dissertation for my PhD was school-age children's attitude and behavior towards injections, the needle. So, I mean, I guess the needle has been that focus in my life, and I didn't even know it. It was just getting through all the higher level degrees that I realized what was the one thing that I was always concerned or worried or wanted to know more about. So I think school age children, could tell you what they want. And I think that's a fear that we as adults give them. I also know that it's a fear that maybe another healthcare provider gave them by the way that they approached them. So today we're not doing all of those things that create pain. So Ameda, is that who you are? I gave your iPhone a name. Is that you? So we call you Omi, right? According to your discussion question. See, I remember. All right, so let's go ahead and let's start the PowerPoint. Everybody was able to download the PowerPoint, no problems. You have it. Okay, because I have other classes where they don't have it. So I'm just making sure you do. If not, got to figure out a different way to get it to you. All right. Infants, toddlers, preschooler. I think this is probably my favorite age groups right here. These are like the most innocent children from, they're born and then you start to watch them grow and mature. So think about that infant. That infant is born, let's say 7 pounds. That infant can't even lift their head. All they do is suck, swallow, breathe, sleep, pee, and poop, right? And burp, of course. That's about all they do. What are they doing by the end of 1 year? They're almost walking and feeding themselves and they're talking. So isn't that amazing? 1 year, what they do, because there are no other years that parallel the amount of growth it's done. It's the most drastic. Central nervous system's growing. Now, what can affect that and stop all those things from happening? It's all about nutrition. If they're not getting proper nutrition, they don't get the fuel they need in the tank, they're not going to grow. Their brains aren't going to be happy. And because of that, you're going to see delays, cognitive delays, growth delays. This is why we weigh children every visit. ER, urgent care, doctor visit. Children always are weighed. Adults, we're lucky they don't, because I don't want them to know my weight, right? But children, they're always weighing. And it's because we're trying to determine if there's any delays in nutrition, which could affect the whole body and the mind, okay? So they're gaining 5 to 7 ounces per week. They're doubling their birth weight by 6 months. Now, I'll say, what if they were born at 7 pounds and now they're 12 pounds at 6 months? They should be 14 pounds, right? And they're not. That means they're not getting enough nutrition. So we need to look at why. Maybe they're having reflux, they're losing, right? Maybe they're vomiting those little pieces of nutrition out. So maybe we need to do something to hold that vomit down, thickening the formula or something, because they need nutrition. Now, what if they were 18 pounds and they should be 14? Well, this means they're being overfed. And overfed children, there could be issues with that too. So these are things that we determine by just knowing these developmental things. Tripling their birth weight 1 year, same thing. They're too little, too much. We can do changes which benefit these children. Now, for the first 6 months, they gain 1 inch every month. They're growing really, really quickly. When they're born, you've got those little, the form that I gave you last week, which showed you the different ages and vital signs. As I said, a neonate, the first 1 month of life, they're going to have a heart rate of 140 to 160, a respiratory rate of 40 to 60, normal at sleep. This is, what they should be. As they get older and become adults, well, what is an adult heart rate normal? 60 to 90, 60 to 100. Respirations, 12 to 20. Can you see how it becomes more effective and more efficient as they go along? Now, when they're born with all of mommy's good stuff. They're given the blood, they're given their iron, they're getting all their immune system, and it wears off. So it doesn't last forever. So there are things that we need to understand about that. When a baby is born, they're gonna have a normal hemoglobin hematocrit, whatever mommy's is. But you don't start making your own cells to after like 5 or 6 months. So you're going to see what we call physiologic anemia. So it's not uncommon for a 6, 8-month-old child to have a hemoglobin hematocrit of 9, 27, 10, 30, instead of the normal, at least 13, 39, 14, it's usually higher, but it's because they're not making it yet. And the babies usually do well with it. They're usually non-symptomatic and they tolerate it well. The iron comes from mom. Now we know why we give iron fortified formula, iron fortified cereals when they get to be about 6 months, because that first 5 to 6 months, mommy's iron's there and then it goes away. So now we have to make sure that we're replacing that iron. Their head, they're big, right? They're born, OB taught you, their heads are large at birth, and then the chest is smaller. As they get older, about 1.5 years, they're about equal, or at least the chest starts to get bigger. So they've got these, what we call soft spots, right? In the front and in the back of the head. Now, the posterior in the back of the head, about 6 to 8 weeks, it closes. So most people don't even realize that there's a little soft spot there. The one that we usually realize is the one on the top of the head. And we're always like other brothers and sisters trying to touch it. Like, no, don't touch that because that's very sensitive, right? Well, that anterior fontanelle is going to stay open up to about 18 months, usually closing about 14 months. And that fontanelle, believe it or not, tells us a lot about a child. If it's sunken, they're dehydrated. If it's really tented and rounded, now you're hydrocephalus. So that fontanelle becomes very important as we go forward and learning about other stuff. Their sight, at first, they see one eye and the other eye, they don't work together. So there's no depth perception. As they get older, they're going to start to be able to see better, and they're also going to be able to hear better. At first, they don't. I mean, many of you have seen, well, the first mobiles on a newborn, they're black and white. They don't see color yet, right? As they get older, they start to see it. So the nervous system, as I said, it grows quick. And we do need all of the nutrition to take care of it. And we know that this nervous system is how they walk, how they think, movement, all of these things. Usually a child up to about 2 years old, still waddling and falling and not so graceful. And they're like, after 2, they become running better and not as awkward and not falling. It's because of that central nervous system, okay? The immune system, again, starts with mom. Mom gives her all the antibodies that she can. Now, if the mother decides to breastfeed, she continues to give that baby those antibodies that they need. And it does protect the infant. If mommy gets sick, those antibodies are given to that baby in the breast milk. So that baby's not going to get sick like mommy because mommy's already made those, immune antibodies to take care of those things. Now, you wonder why we give all of these immunizations, 2 months, 4 months, 6 months. It's what, 5 in each, time they give it. And you wonder, it's like too much, right? These things that they give those immunizations for are life-threatening. And these things are dangerous if these infants get it. They have no defense against them. So they have to get these immunizations. So now their body starts producing all of their antibodies and they can protect themselves. We have that Vernix, as a really good cheesy looking baby there on the right. And that's actually protection from birth. It protects them when they come out. They're not going to get an infection. And some of them are that cheesy and some aren't at all. Now, when a baby is born, remember they're inside, the uterus, inside water, amniotic fluid, right? So they're sort of puffy from the fluid in there. So when they come out, they have nothing to keep that swelling from that, keep it warm. They'll get very cold very quick. If you've ever noticed, at birth, the first thing they do is put them on a heated warmer, right? To keep them warm. And they'll put a temperature probe on them, to make sure that they keep warm. Now, usually after that, they're sent to the nursery. The nursery will clean them up, whatever, weigh them, measure them, do all their whatever they do, and they'll send them back to mom. And usually that baby looks different. They're not as puffy. All that extracellular fluid, they start to urinate, and then now it's a cute baby. It's not so swollen like it was when it was born. Now, all their systems are very immature at birth. Their kidneys are very immature. And, one of the things that we say, as long as they're having 6 wet diapers a day, they're doing well, okay? It's when they don't have those wet diapers we look at, what's going on with those kidneys. The digestive system at birth up to about 6 months old is pretty immature. It doesn't tolerate any sort of foods. And if we give anything besides iron fortified formula and breast milk, it's just going to come right through and you're going to see it in the stool. We're not going to tax that system. Now, if an infant has reflux and they're losing nutrition because of vomiting, we want to keep that down. We will thicken that formula and we'll do rice cereal. And it's 5 mLs in 1 ounce of formula or breast milk. It thickens it and it holds it down. You might see it in the stool, but it serves a purpose. It's not for calories. It's not for nutrition. It's to keep the milk, which is the nutrition, in the body. Now, infants, as they're growing, initially, you take your finger and you put it by their hand, and by reflex, they're just going to grasp it. It's called a reflex palmar grasp. Now, this is, most parents go, oh, look, my baby's hugging me, and, around my finger. And I'm not going to tell them it's a reflex. I'm going to let them think their baby's hugging them, right? Well, it becomes voluntary after a little while. So it starts about, at birth, you're going to see it, and then it's going to become that voluntary. And then it's going to start with what we call a pincer grasp, which is a thumb and a finger. About 6 months old, we like to put the babies up in high chair, and maybe we start wanting them to have like these little snacks, those little puff things or Cheerios or whatever, and they're going to take their finger and one at a time, right? Well, usually it starts with this crude smush in the face, right? But they're all, and then it becomes a very fine pincer. As they get a little older, about 11 months old, they're going to take stuff in and out of containers. And then by 12 months, 1 year, they could build the blocks of 2. Now, this is called fine motor. It has to do with their hands. F, fingers, okay? Fine motor. So there's fine motor and there's gross motor. So fine motor, anything with the hands. And that will test you. Now, gross motor is what I call get up and go, go, go. It's movement. And it starts with the head being able to lift up. About 2 to 3 months, they say it should be. By 6 months old, they should be able to roll from abdomen to back and back to abdomen. And then they're going to get up on their knees. And they're going to start to be able to crawl, usually backwards first and then forward. And then about 9 months old, they can pull themselves up to standing. And that's when they usually start that moving around the couch and creeping. By 8 months, they should be sitting on their own without support. And then as they get older, by 12 months, they should be able to voluntarily try to take steps by themselves, but it doesn't mean that they're walking then. At least they're standing, attempting to move the feet like they're gonna walk. Now, you have kids who walk at 6 months. You have kids that don't walk, which were my kids. My grandson didn't walk till they were 15 months, and they never walked, they ran, which means they had 28 steps the first time. And that's not considered walking, that's running. So all children are different. And the one thing you need to remember, every kid is different. This is why I tell you, if you have children, grandchildren like me, don't look at what those kids are doing to answer the questions, because it's such a broad variety. You need to look what the book says. And that's the most difficult part sometimes when you talk learning these developmental stages in children. Now, nutrition, first 6 months, either breast milk or iron fortified formula, right? We need that iron, right? Breast milk should be encouraged, but not everybody can do it. So if they can't do it, you're gonna recommend iron fortified formulas. And we'll start out with the Similac or Enfamil. Those are the easy ones they start out with. And then if they can't tolerate it, they change it to the soys, whatever. But that would be the first thing they try. Now, one of the things about breastfeeding is parents get, especially if they were in the ICU, go, I don't know how much they ate. I'm concerned they need to eat more. And I will tell them, when you get home, stop thinking about, how much, milk, because usually in an ICU, we're measuring everything because we're OCD about that measurement stuff, right? Well, when they get home, they're not going to measure. They're just going to put them on the breast and let them nurse that 8 to 10 minutes each side. As long as they have 6 to 8 wet diapers per day, they are doing well. And it doesn't matter if it's stool or urine, there's something coming out. And we know breastfed babies do have more stool than does a formula-fed baby. It's just what is. Now at birth, they lose 10% of their body weight, all that extracellular fluid, right? And then all of a sudden, by 2 weeks, they're catching up. They're back to birth weight, and they're gaining at least a ½ ounce a day for the first 2 months. Now, because of the lack of vitamins, of the iron, etc., in the breast milk, we do feed breastfed babies vitamin D. Now, second 6 months, about at 6 months of age, you go to the doctor and they say, okay, time to feed your baby. You can give them something. Well, usually the first thing they'll tell you is to start with rice cereal. It is the most babies are rarely allergic to rice cereal. And you will only give it for 4 to 7 days and nothing else. One food at a time, and to make sure that they're not having an allergy. Now, what do you add second? All physicians, all pediatricians are different. Some say fruit, some say vegetables. A lot of times it's your choice. But the key is one at a time, 4 to 7 days in between the introduction of another. Now, what are you looking for? Well, you're looking for allergies. Now, allergies could be a rash. It could be a colicky, abdominal pain, vomiting, diarrhea. It could be very subtle, or it could be, oh, I know this kid don't like that food. And then what usually the pediatrician will say is, all right, don't give that again. And maybe later at a year old, reintroduce it, see how they do. Now, dental health, babies, usually they say at 6 months start giving a tooth up. Now, the one concern is, babies getting teeth and brushing teeth. And when do you do this thing? Well, actually, me as a pediatric nurse now, but I wasn't at the time, as an adult ICU nurse, propping that bottle, I used to have very close together. So I would prop them, and now finding out that, what I did on my second child, he had bottle mouth, the rotten teeth, because, he would take a bottle to bed at night. But, as we learned through the years, we've learned not to. As soon as a tooth comes up, you should brush it. Just water. Just scrub them to get off just the exudate on the tooth. No toothpaste yet. At 6 months, they say baby toothpaste, and they do have it. Again, then they go to bed at night, only water, nothing else. Now, pacifiers. Pacifiers, they've gone from they're good, they're bad, they're good, they're bad. Well, they finally realized with a lot of research that they actually are a self-soother. Children get stressed. Children explore the world in their mouths, and pacifiers are very important. Pacifiers can help them through a lot of painful situations. So using them is actually good. And the teeth, it should start at 6 months, and it should be, so if you're 8 months old and it says the number of months minus the 6. So if they're 8 months old, they say they should have 2 teeth. Not all children will, but that's usually that ratio, 1 tooth per month from 6 months on. Babies sleep, they sleep a lot, and they should be sleeping at least 9 to 11 hours. One of the things about breastfed babies, it's more watery, it's not as thick as formulas, and they tend to need to be nursed more often. It could be every 2 to 3 hours. That's why a lot of mothers decide not to breastfeed, because they need to work, they need to take care of business, so they don't because of it. But, that is a choice of that parent. Children, they do eat, sleep, play a little bit, tummy time, and they take naps. And they're saying that walkers, swings, playpens are not necessary, but we all have them because they're cute, right? Those little swings, you put them in, they make sounds and noises, they swing, they fall asleep. The book says they're not good. Now, these are all of those immunizations that they need to get at one time or another. And the one that we give at birth is hepatitis B. Hepatitis B is given at birth, and if not in the hospital, the first visit to the pediatrician, they will get it. Now, colic, one of the things that lasts for a couple months, and it leads to a lot of sleepless nights for parents. These children, no matter what you do, they are crying because gas in the stomach and cramping and painful. And, that's the colic hold where you try to, slowly, gently rock them and move their position, try to get their gas away. I mean, all different things are given, those little Gas X type of drops, little gases or whatever the name of them out there. Or maybe it's making sure the baby's fed, not overfed, burping in between, sitting up after meals, maybe, changing their position frequently. Sometimes that helps. Now, sometimes babies, like I said, aren't growing the way they should. And if they're really severely underweight, like at 6 months, my 7-pound baby at birth is only weighing 10, 11 pounds. We call that failure to thrive. And when they're not getting enough nutrition, what did I tell you happens? They're not going to grow. We're going to see those developmental delays. They're not going to hold their head up. They're not going to turn over. They're not going to grasp. All of those things, they're not going to go where they should because that fuel is not being given to the brain, the central nervous system. So we take it very seriously. And failure to thrive, it goes through why. How do we get this baby to eat? And they'll go through a whole series of tests for it. Now, positional plagiocephaly, all that means is a flathead. Kids today are now back to sleep. Let them sleep on their back. It prevents SIDS. It has been proven with research by many pediatric facilities. Nicholas Children still watches it. And they've been doing it since the 90s, watching children. It used to be on their back and on their sides. Well, they found out on their side still causes death. Now they're just saying on their back, and they're still watching it. Now, the back of the head can become flat, right? And that's always a concern of the parents. So what do we do to help this plagiocephaly or flat head, or, one side, not shaped round like it should? Well, put them on their tummies, tummy time, for at least an hour a day. When they're wide awake, alert, put them on their tummy. And that helps because their scalps are so soft, and
It
their
increases
teeth
the blood flow,
know.
right, Professor?
Well, that too, absolutely. But it also stops the pressure on the head and it allows it to expand, and it comes back quick. Now, some of them require those little helmet heads, as I call, but usually, if you have a diligent parent who puts them on tummy time, they don't need it at all. These flat toaster heads, sometimes we call these little preemies, they will round out and have perfectly round heads. Another thing that can happen is diaper dermatitis. Now, it could be caused by many things. It could be caused by the type of ointment or cream you use. Diapers are a big thing, in the very early stages. My children did not like Huggies. Cannot put it on them. That's what they look like in one day of wearing Huggies. We decided, okay, let's try another diaper. It cleared up. We were good. A kid with dermatitis will keep you awake all night long because that diaper rash burns once they urinate. So the key is to prevent it, right? Good emollient cream, change the diaper frequently, and find out why are they getting that. Usually it's the diaper or the cream you use, mostly the diaper. Now, at 6 months, when you start feeding those children, it could be the food you gave them. If they've never had a diaper rash before, that is a reaction to the food. So paying attention, taking care of it, can save you a lot of sleepless nights. And then, of course, cradle cap, when their head is full of all of this flakes and stuff. And, you're like me, you want a nice little bow and a cute little ribbon in the hair, make those little girls look cute. The little boys, you want their hair combed pretty, and it's all full of flakes. And you're like, well, what do I do to make my kid pretty, right? Well, just normally bathe them with soap and water like you normally do, comb their hair with a fine tooth, very gently comb it. And sometimes they put even mineral oil in and leave it in overnight. And that does help, get that crusty away, but it doesn't happen overnight. SIDS death, this is why we put these babies on their back. Now, what are some risk factors? Males more than females. Also, if there is any smoke in the house, one of the big things that you see, if they're overdressed. So, if you're comfortable with one set of clothing on, your baby don't need more than that. Okay, don't think they need a hat and mittens and socks and booties and 6 blankets. No, if you're comfortable, the baby's okay. Overheating can cause a SIDS death. If you're breastfed, you have less chance of SIDS death. So that's another recommendation for it. And then, of course, having them in an environment where there is air conditioning and no pollution, et cetera, et cetera. I mean, remember, not all people have a house. Not all people have all of these luxuries. So these things can happen. Another thing that can happen is what we call an ALT, or an apparent life-threatening event. This is when the baby chokes, gags, and turns blue. It could be due to reflux, or it could be due to other things. These infants, you say that this baby stopped breathing, he turned blue, we will admit them, and we're going to do a lot of examinations on their brains, make sure they're okay, and on their GI, making sure that there's no reflux. These children usually will be sent home on a apnea monitor. And it's just a little Velcro strap with 2 leads and 2 wires, and it measures the heart rate and it measures the respiratory rate, and you set monitors, the little alarms on them. If it goes too low, there is an ear piercing alarm that goes off to wake up the baby, also to wake you up. So think of this. Letitia is a breastfed infant seen at the clinic for a 6-month-old checkup. The mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best intervention? Is it normal to suck your thumb?
Yes.
That's the answer. How do babies soothe themselves? Their mouths.
Mm-hmm.
Whether it's their thumb, whether it's a pacifier, a finger, whatever it is. And they need to do that. They need to learn how to soothe themselves. All right. And now we have our theorists. As I said, there's 4 that we really look at, and here they are. So let's start with Erickson. So think about theorists. It goes through infant, toddler, preschool, school age, adolescent. And each one says something different. They're telling you about something about the child. Piaget talks about thinking and being able to, figure things out. Erickson is about how they're going to do things. It's more of getting things done. Now, an infant, what does an infant want? It wants to eat, wants their diaper changed, and wants to be held, right? So if they cry, mommy comes and tends to their needs. That is the trust. That's trust on Erickson. That's a question you see on Hesse's and NCLEX all the time. Erickson, trust versus mistrust. So what is mistrust? Nobody comes. I'm in there crying. Nobody comes. Whether the mommy's tired, maybe it's some sort of, their substance abuse, whether homelessness, whatever. If a baby's needs are met, they trust they're happy. They are calm. They're happy babies. Mistrust, they're not happy, and you're going to see them. They're not going to be those happy babies as you like. And they actually end up in the end, when they keep crying, nobody comes. They end up just not crying anymore because they're like, okay, nothing happens. Now, sensor-motor is Piaget. Sensor-motor is also called, the secondary operational. And it's talking about sensor-motor. Now, sense is what you touch. Ori is in the mouth. Motor's movement. Let's say it's birth through 18 to 24 months. It's all about exploring the world in their mouths and the texture of stuff. It's about taking that rattle now with a voluntary grasp, and all of a sudden they move it and they hear a noise and they go, ooh, that's good. And they rattle it again. Remember, cognitive, Piaget, cognitive thinking, okay? As they get older, they start doing things like making broomsticks into horses, and riding broomsticks around, making things, into something, thinking, making it work. Gets the concrete operational. And this is where they're starting to really understand and be logical, and they know what they need to do to get things done. And then adolescents, the sneaky group, as I call them, they know how to manipulate a situation to get what they want. Even if they have been, grounded, they're going to say, but I did this and I did that. And they're going to have all these scenarios to get what they want done, right? So primary circular is when all of a sudden they suck their finger. Again, it's cognitive. This is thinking. Secondary circular is now I'm playing, I'm rattling, right? So as they start with number 1, they grabbed it, the thumb, they like it. Now they grab the rattle, now they shake it. They're building upon that. And they're starting to make more of it. So sensory motor, part of it is your primary circulars and your secondary circulars. And some of this is imitation. Now, take a little baby who's a 4 or 8 months old. You can look at them, stick your tongue out. Guess what? They're going to stick their tongue back out you, right? Because they're trying to imitate you. That's part of it. So as they get older, they're starting to know who they are, see their hands, their feet. If you put them in front of a mirror, they're going to be enamored, like, ooh, look at that, touching it, realizing that maybe it's them. They're going to get into what we call object permanence. And I described this last week. And this is where you show them a toy, but then you hide it. Let's say behind a toy. So then now they have to sort of like reach for it and sort of like inch and crawl for it. Because even though it is out of sight, they still know it's there. I mean, as they get older, like a 1-year-old, you put their toys to bed at night, right? They wake up in the morning, they know to go find them, even though that they're put away, they know where they are. Attachment, they don't, they want to be with mom and dad and or whoever their person is. I mean, my grandson was always Nana and Pop, but it's just they want those people. Separation anxiety, between 4 to 8 months, right about 6 months. They do not want to be taken away. For instance, take them to a doctor's visit and the nurse needs to take the infant and weigh them. They're going to try to put their arms back out and grab mom and dad. As a nurse, have the mother put them on the scale, right? Why do you want to create that child before getting upset? And it's the same thing that we talk about with stranger fear. I mean, these children, they're afraid of us. So we know it at that age. So what can a parent do to help us to prevent that also? And then as they get older, well, let's have some fun. As I said, I went to work every day as a pediatric nurse to play. And I played with kids of all ages for 25 years. And it was a lot of fun. And even in the most horrendous situations of baby crashing, child crashing, you still had to say that there was some fun with it, because in the end, you have that child there. Maybe they were holding your hand, right? So it's your classification of fun. And that is part of, children, making them like you, not like you, but trust you, that you could go up and you could hold them and play in things like peekaboo is a big thing. Peekaboo is a great thing with infants. As they get older, they start with cooing and crying. That's what babies do, right? And what do all age children do? They play all day long, right? An infant might be sucking their fingers or their rattle, or they might be on their tummy trying to look for something as they get a little bit older, 4 or 6 months. And then they get to be toddlers, preschool. I mean, you got to keep them in it with all these toys, whatever they want, having them play. And of course, make sure the toys are age appropriate. And there is something called a temperament. All children have a different temperament. You've got the happy children, you've got the quiet children, and whatever the kid is we need to treat him that way. That kid who's quiet, that's a child that you would speak to quietly, that you would move quietly, that you wouldn't have big bright lights on. A kid who's happy, be the one that you'd go, ooh, peekaboo, and see that they come out and they play with you. So let's go on to the dive bomb kids, as I call them, the toddlers, ages 1 to 3. Great age. This is the age of exploration. And I love this Jerry Seinfeld. Having a 2-year-old is like having a blender without a lid on and turn it on. Poof, they're everywhere. As in, they're in 6 directions at the same time. You can't keep up with them. They are everywhere. And now they're underneath the couch and they're tangled up in cords, and it's just what they do. Now, also, terrible twos. Me, mine. They're very egocentric. It's all about me. They don't like sharing. They play alone with my toys and they don't want to share. That's what toddlers do. Now, at this point, they've tripled their birth weight by 1 year. It slows way down. By 2.5 years, it should have quadrupled. So now you've gone a year and a half. You've gone from tripling at 1 year. Another year and a half later, it's only, one more time, it's quadrupled. Amazing, huh? They don't get much taller, but now their legs are getting longer. And their head is not as big as their chest anymore. The chest is bigger. And look at that. At age 2, a child should be about half of their adult height. As they get older, now we're going to have that maturation of systems where they're starting to get mature. Their respiratory system, their urinary, their bowels, their being able to fight off diseases is getting more and more effective. Now, one of the things toddlers do is just what they do. And many children are usually with families, if you're lucky to keep them home, or they're in daycare. And what do they do all day long at daycare? They swap their spit between the toys, from this toy to this kid, to this kid, to this kid, with my mouth, their mouth, their mouth. And is that a bad thing? Well, you can't prevent it. But it's also building up that immune system for them when they get older and get into school. They're not going to miss as much school because of it. Upper respiratory viral infections are like common. And because everything is explored in their mouth, toys, everything, shirts, everything in their mouth, they're going to have a lot of that tonsillitis, and ears are connected to the back of your throat. So otitis media, short, straight canals, they're going to get full. They get a lot of ear infections. Common, common, common. And then, of course, we're going to be trying to get them potty trained. And we know bowels come before bladder. It's easier to control. Now, gross motor, get up and go, and fine motor, fingers, starts to get more and more better as they go. So between 2 to 3 years, they're going to be not as clumsy and awkward walking, etc. They're going to be able to use both hands now by 12 to 15 months. And by 18 months, poof, I'm going to throw a ball. Now, it doesn't mean it's going to be where they want it to go. I know my grandson, when he threw a ball, you better be prepared because he threw it pretty hard and it would hurt. So you got to be careful with it. Their vision, so much better. They're seeing now. Remember, both eyes started off not working together. Now they're completely working together. And they've got really good depth perception, and again, the one big thing we worry about with these children is jumping off the couch onto another couch or onto a hassock or onto a coffee table, and they miss it. It's because that depth is not completely there yet, and they think they can do it and they can't. So again, they're going to have these mishaps because they're the dive bomb kids. Now, as an infant, they eat anything. Put it in their mouth, they eat it, it's good, yum, yum, yum. Well, all of a sudden, their taste gets a little bit better. So they're understanding it. Textures are also some big things. They become picky, 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 picky eaters. And they call it this physiologic anorexia. I can't tell you how many toddlers I met that the only foods a parent could feed them was chicken nuggets and macaroni and cheese. That was it. They wouldn't eat anything else. I was blessed. I had a child who liked fruits and vegetables. Give him broccoli and a banana, and this kid was happy. But most of them, have that certain thing. And parents are concerned. Now, what would you tell them? As long as they are developmentally where they need to be and they're gaining weight, they're getting enough nutrition. They only need a tablespoon of food, per year of age. That's it. And then, of course, if they have something to drink too, apple juice is, that other normality that they do. So Erickson Erickson on a toddler. Well, toddlers don't want you to tell them what to do. They want to explore and they want to do it. Remember, me, mine, I do. That's a toddler. That means they want to jump off the couch, even if they're going to bust their head open. They want to do it. Now, what's the problem with it? That's the autonomy. Autonomous, being who they want. What's that shame and doubt? That's when mommy says, no, you can't do that. You're going to hurt yourself, and don't let them do it. Or they're riding a bicycle or that push thing that they can do at this age. And mommy said, no, be careful. There's a thing in there and you're going to fall over, and wait, come over here. Don't do that. Well, again, that you need to let these children try to do things. Again, you don't want them to hurt themselves and protect it, but you need to encourage them to, explore and to figure things out. Another thing about toddlers, they like routine, ritualization. That is a lot of comfort for them, and they do understand, it's me, but they don't understand about sharing yet. That's not toddlers. Now, Piaget is now they're thinking more, okay? They're starting to take things like a truck and figuring out it rolls, and then getting a car track, putting it together, and it will roll over that. They're starting to put pieces together. It's not just a car on wheels. What can I do with that car on wheels? It's learning, and they are really putting things together really, really quick. Again, it's by the sense, the touch, the moving around, and now it's taking that to another level of, all right, now let me take that track, put it on top of the couch, and let me now roll that car down that track, down that couch, onto the floor, and woo, it goes across the room. They did that, not me. That's that cognitive learning, figuring things out. Basically, this is talking about the same thing. Again, remember, Erickson is autonomy, doing it by themselves, or being held back by mom and dad, and that's the shame and doubt. And again, no, negative, love structure, routine, and this is something that you need to try to let them do. We talked about sensory and motor. Here's those other examples I was talking about. So primary, I found my thumb, it went in my mouth. Ooh, it's like a pacifier, right? And how do they calm themselves? How they explore their world? Thumb in the mouth. All right, they took that rattle and it moved, and I hear a noise. Now they can shake it. That secondary circular reactions. And then as they get a little older, 12 to 18 months, sitting in a high chair, throwing the bottle on the floor. Why would they do that? Well, they know mom's going to come pick it up, right? And rinse it off and give it back to them. And maybe mommy was in the kitchen fixing dinner or something else, and I wanted mommy here next to me. So poof, bottle on the floor. I know she's going to come back. Children are smarter than you give them credit for. Now, as we get a little bit older and we go to concrete operations, we're going to do that in school age next week. I'm not going to go into all this conservation now. I don't want to confuse you yet. Now, toddlers, they're starting to figure out there's a penis and a vagina and there's differences. You're starting now to do potty training, right? Potty training. Watching daddy go pee. If it's a girl, they're like, but he's standing up, but mommy's sitting down. And again, what is that? And they're starting to touch themselves in those places. And it's okay. Now, if they're touching themselves out in public and they're understanding, I would say, go to the bathroom or go to your room if you want to touch yourself. Don't do that here in front of me. That's not appropriate. They're starting now to understand boy and girl by the end of toddler. They know you're a boy and I'm a girl, okay? So sometimes, they have to go into daycares, they have to go to people's places, and they know that mommy and daddy are certain people, but other people can watch them. And there's differences. And you'd be surprised, they learn how to control those differences to get whatever they want. Because sometimes other people tend to not look at things and let them do things. And I've seen that even with my grandson with that. You know, children are individual, they have their own things they like and dislike. It could be one kid has a blanket, one kid has a stuffed animal, one kid has a book. It's something that they want and they've got to be with them, and that gives them comfort. Their language, by the end of the first year, they should be saying one words, mama, dada. That's fine. As they get older into toddlers, their words are going to get more and more. Now, sometimes they can't express themselves completely. They understand, but they can't tell you what they want. So usually it's mom and dad only understand, or grandma like me only understand, because it's just the way that they express things. And that helps them from getting frustrated, right? Toddlers want to be independent. Me, I do, mine, right? They want to feed themselves. Does it matter if the spoon is upside down and they're feeding themselves? No. Does it mean there's delay? No. It just means they're experimenting. Let them do it. They also, as they get into potty training, are going to be maybe pulling up their own clothes or putting on their own underwear. Maybe it's on backwards, inside out. It's not the point that it's inside out and backwards. It's the point that they're attempting to try. Okay. And not making, no, don't do that. I'm going to do it for you. No, let them try. And the other thing, 1 to 3-year-olds, you don't think this, but they really do have feelings towards other people. You know, I suffer from rheumatoid arthritis. And I remember when my grandson was at this age, my left knee was in so much pain. I was sitting there on the couch packed in ice. And he came up to me going, Nana, boo boo. He says, kiss, all better, Nana. And it's a 2-year-old. I'm like, okay, it really does work this way. They do understand and they have those feelings. Now, as I said, play. This is all kids do. And it's part of their growth. It's their imagination, their cognition, that they're starting to understand how to put things together and make it work, right? It's playing with other children, which is hard initially, because usually you have your toddlers, they have parallel play. Parallel play, what is that? Well, one toddler's playing here, one's next to them. They are playing with different toys, not together, but they're next to each other. That is parallel play. That is so toddler, because they don't like to share, right? They don't like that sharing. And they try to imitate what you do. And they love all different textures, whether going out in the sand or the mud or whatever, or different texture toys. They love that. Now, toilet training. No, there are certain things that you'll see them getting ready. Maybe they'll be running to the bathroom or watching mommy or daddy, you know, peeing or pooping or whatever, because that's what they do. And you can start that potty training with them. They get upset with older and younger brothers and sisters. And it's, you know, that rivalry, because, you know, they want to be the center of attention, you know, especially if there's a new baby. Have that new baby and you have a toddler on hand, you know, you've got to actually make them feel important. So they are working with you, not against you here. Temper tantrums, what do? I'm going bonkers, going crazy. What do? It's the middle of Publix. And they throw themselves on the ground, screaming and crying. How many times did it happen to any of you? What should you do? Leave them there, as long as they're not hurting themselves or others. If they're not in danger, walk away, because what that kid wants is your attention. So if you walk away, they're going to stop and just follow you. If you have them out of the cart in the first place, a 2-year-old, usually I have them in the cart strapped down. But If not, that's what you would do. If it happens at home, same thing. Having a temper tantrum, okay, go ahead. Have your temper tantrum. They're safe. They're not hurting themselves. Walk away. They will stop. We
Professor, I
know that.
have a
Good.
question.
Sure.
You know, I've been in like situations like I'm in a line or something like that, and I see like a mom with her 2 kids or whatever, and like they'll do a temper tantrum for like 20 minutes, and it's kind of it's like crazy. What would you do in that situation where like the kids are just like really out of control? They're not really being like they're not fighting or anything like that, but it's just like wah 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 wah, like all screaming.
The thing is, most likely at home when they have a temper tantrum, they pick them up and they do what they want. Just like if you've ever heard the thing, putting them to bed, infinite bed at night, it might take you 3 nights to get them in their own crib. They're going to cry really hard and then you leave them there. So usually, this is a great question, because usually what that is that parent has, gone, it's all right. He's having a temper tantrum. Let me pick him up, give him what he wants to shut him up. And what they've done is they're going to have a temper tantrum in Publix when they can't do what they want. And then all of us have to feed into, oh my God, I need some earplugs. Yes, absolutely. How would you? Parents aren't going to listen. You can't tell them what to do. They're going to say, get out of here, mind your own business. You don't have kids or
Walk
all
away.
those stuff. But anyway, that's usually what it is. Temper tantrums, bedtime. How do you stop those? Well, create a nighttime routine. We're going to go read a book. We're going to sit together, have a nightlight, have your last drink if you go to bed, go pee, brush your teeth, whatever. On a schedule. They do a lot better. As I said, no, me do. And the one thing you're going to see, children, when they're overstressed, they're going to start maybe sucking their thumb or peeing in their pants when they're potty trained, when they're stressed. And when you see that happening, what's going on? Is it maybe because you got a divorce, right? Those things happen. Or the dog ran away. Or grandma hasn't been here in 2 weeks. Those things stress children out. So sometimes it's finding out what's going on with that kid. And that kid's telling you something. I haven't sucked my thumb in years. There I am. Something's gone on. So throwing a ball by 18 months. Refinement of coordination, 12 to 15. Fine motor dexterity, and you see that up to 2 to 3 years. Just certain questions I put here just to help you. Social development, we know by 1 year, it's one-word sentences. By 2 years, as I said, multi-words. It might be not understandable to anybody, but usually parents do understand. They're starting to feed themselves, play by themselves, dress themselves, even taking their clothes off in the middle of, you don't want them to take it off. They're taking their clothes off. It's just part of what they do. We know that parallel play, absolutely toddlers. Now, does it happen in all ages? Yes, but specifically toddlers, usually it's parallel play. Next to each other, don't touch this, my stuff, mine, right? But they're playing next to each other. They love to imitate. If I'm doing something, let's say I take a track, put it together, roll a car on it, and I give them tracks in a car, they might want to do it too, right? And again, it's that touch and making sure they have good toys. Now, car seats should be rear facing till 2 years old, and they say 30 pounds, right? And then turn it around at 2 years old. What happens if your infant at 2 years old is only 26 pounds, like my grandson? What do? Well, I went to the pediatrician, my daughter did. I let her do it. I can't tell her what to do. I didn't think this is she lived with me. I was like, no, I'm going to tell you what to do. You don't know? Ask your doctor. I mean, it's what I said. They're 2 years old. Their muscles in their neck and their coordination is strong enough to tolerate being front facing, even if they're not 30 pounds. Just put them in an appropriate car seat with harness, right? And then following it up as they get through. So rear facing first. Now, preschooler, ages 3 up to ages 6. Okay, preschooler. Now, these kids are getting smarter. This is the age where you're getting them ready to go to school. They are they love, many of them who have been given the opportunity to read those books at night and color and do letters and practice all this stuff with mother. They're getting ready to go to school, right? You know, one of the things parents need to do is to promote this healthy attitude towards learning. And when they do that, these kids are so excited to go to preschool. Now, they do go away. They are okay to be in those periods of time away from mom and dad, right? And their attention span is long enough to be able to tolerate it. And they're starting to have a good memory here. Again, everything is slow. Everything slows down. You know, again, first year of life, nothing compares to it. From there on, everything's slow. Preschoolers, gross motor, which is get up movement, go, 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 like Paw Patrol says, right? Walking, running, climbing, jumping, you can do all that stuff. Jump on one foot, you know, hop on one foot. They can do these things. Fine motor, they're able to dress themselves. They can draw. 4 years old, they can button a button with their fingers, right? By age 5, they can start doing, what is it? What was I was reading? I think it's their shoes and trying to start to tie their shoes. Not completely, but they will. Now, Erickson. All right. So we've talked about trust versus mistrust, infants. We've talked about autonomy versus shame and doubt, toddlers, which means they want to do it, but you're telling them not to. Now you get to initiative. And what this is all about is they want to be able to do things, but they're afraid they're not doing it the way you want. Can you imagine these children, ages right after 3, so 4, 5, 6, something's going on here. Also, they're starting to know when they do something wrong. They get a conscience, which is also super ego. So I, had a sandwich. Mommy went to the bathroom. I went and threw it in the garbage because I didn't want it. And they know it's wrong. They're starting to say, well, I shouldn't have done that. And sometimes they even report on themselves. And again, part of the wrong and right, Kohlberg, wrong and right and understanding what they do, which is right or wrong. As I said, getting ready for school, make sure that you're positive attitude and that you read to these children. Now, Piaget. Piaget is starting to think about others now. It's not just all about me and what I want. It's starting to think about, the group. So now they're becoming more aware of how to control a group and what they want. Their language, they're getting more and more able to express themselves. Some of the words that come out of my grandson, he's 6.5 now, I'm like, where does he learn these words? They're big words. I'm like, okay. The concept of casuality is if you do something, there's something going to happen, whether good or bad, right? Now, concept of time is not understood. Don't tell a child that at 2 o'clock we're going to the beach. And they ain't going to understand. But if you tell them after lunch we're going to the beach, they understand that, okay? By 4, on top of, around, over, under, those things at 4, they're starting to understand. And they're also magical thinking. Ever see a child who's 4 or 5 alone, sitting there playing with toys? They're talking to themselves. It's all this magical thing, and the truck is going to talk, and the doll is going to talk, and flying in the air, and whatever, all magical. Now, Kohlberg, as I said, Kohlberg is all about right and wrong and the consequence for either doing right, which is a good consequence, or doing wrong, which is a bad consequence, right? So they're starting to understand what they should do and not do. And if they do it wrong, they're expecting a consequence. Sexuality. Now, They have an attachment to the opposite sex. So my grandson, of course, loves Nana. That's just what it is. He loves his mommy. And daddy would be a little girl. The little girl would go more that way. It's just what they do, okay? They're starting again to explore themselves more. And they're starting to ask, especially if you have, mom's having another baby, like, where does the baby come from? Now, you don't have to go down and dirty on how you make a baby. So you would say, so where do you think it comes from? And answer the questions as they ask them. Don't give them more information than they need, because they don't need that much information at this point. Now, this child is a preschooler. They don't need as much routine as a toddler. They can go on vacations and do so much better than a toddler can. Toddlers are hard. They're going to have fits. They're not going to sleep. They're going to be more difficult. But a preschooler, they tend to understand and they fit in better. They can dress themselves. They want to please. They know the family and what's expected of them. And they know if they want something, they are going to challenge that family. Like, well, but you said this is like that, and I want to do that. And why can't you tell me I want to do it? And they're trying to make sense of it. Now, toddlers are parallel play, right? So now we have preschoolers. Now, preschoolers are associative play. Now, play is important. You're going to see these concepts again. Associative is playing together with the same things, but there's no goal. There's not like building a castle. There's not like a board game that you win, that there's a winner. There's no goal. It's just, you're just playing, okay? But together, same toys. Imitative play is playing like somebody else. Imaginative play, of course, there's, imaginary playmates. Preschoolers, absolutely normal, and an imaginary playmate. Now, if they're school-age children, 8 years old or something, that's not normal, and it's something that needs to be looked at. There's dramatic play where they can act out things that have gone on, and again, of course, playing together. Now, preschoolers, their fear. I mean, the dark. No, I can't go get my jammies. It's dark in there. I'm afraid of the dark. We'll turn the lights on, okay? They do not want to be left alone. And if they don't see you or hear you, you're going to hear them screaming, Mommy, Nana, where are you? And you have to answer them. They don't like it. Also, animals. They're very afraid of animals. They're afraid they're going to hurt them. Whether or not they've been injured by one, they're afraid of them. They're afraid of ghosts, which is like the dark, right? They're afraid that their body parts are going to be removed, their penis or their vagina or something. They're afraid of those things. And they're afraid of us, the nurse. Objects are people associated with pain, because what do we do as nurses to these children? We give them injections, usually, right? Most of these are well visits. They come in, we're giving those immunizations. So they are afraid of us. So we're already behind the 8 ball with trying to get on their good sides. So as I said, sex education, find out what they know. And the one thing is said through the literature, use correct anatomical words. I mean, my Christian, who's 6.5 now, he knows he has a penis and he has balls or testicles, and I have a vagina. And he has a butt and it needs to be washed. He understands the word. And I don't make it that it's this, ooh, that crazy word, because it is what it is. There are cultures that want to call it a TT and a tutu and a tata or whatever it is, whatever works, but they're saying today that's the way it should be. And they're starting to play with themselves. Usually you'll see that when they're off on their own underneath blankets and things. Just make sure if they're doing it in front of you, that you send them, go to your room. Go to your room and do that. Yeah, I don't need to see that out here. Don't make it a bad thing, or they're going to feel sexual stuff is not good. And now we're ready for our cahoots. A lot of good stuff, huh? Infants, toddlers, preschoolers, a lot of stuff. Any questions? All right, who's going to win at Cahoots today? Veronica, are you going to win today? And she just smiles. Amy, you're smiling. Adiel? Yeah? Here we go. Now, there's a lot of them. I'm going to try to go through them pretty quick to get you out on the time that I've always said I would. So go to kahoot.it, put number 724-0025. All right, let's get going. I know you're still coming in. Just keep coming. It's good. Another multi. Types of play considered to be sense pleasure. Remember, sense is all about touch. You know, and especially toddlers, they love to do it, smushing mashed potatoes and playing in sand, finger painting in the mud, all of that good stuff. Checkers is nothing they touch that they like. Doesn't have a sense to it. The nurse notices white patches in the mouth of an infant that cannot be removed with a tongue blade. What should you do? No, I can't throw everything into a PowerPoint. So when you see one of these questions like, oh, I didn't mention this, it's because I needed to mention it, and this is a great forum to put it. So that white stuff, hongo, is a Spanish name for it. And try to get it off, it don't come. This is a fungus. It needs medicine. So this is nystatin that you would put. Usually it's swab. You know, they stick it in and they just take a Q-tip and they swab it around on the newborn infants. And then make sure that you clean those bottles good, or the nipples on your breast good. What type of play is considered cooperative play? Now, we've mentioned parallel play, associative play. So cooperative play is more sophisticated. So cooperative play is there's a goal. 2 or more children play together and there's a goal. And board games are a great way to describe them. Or what if they're playing in the sand? They build a castle and they put a flag on top. That's their goal. So whatever it is, there's a goal in the end, and that's the key word, a goal. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning. What does Kohlberg talk about? Remember, Kohlberg is good and bad consequences for each. It's all about understanding doing right and when they do wrong. Which nursing action is appropriate to teach a preschooler child about a scheduled procedure? So you can take a kid, he needs to come in, let's say, has to have his tubes, right? Adenoids out, tonsils. How do you think a preschooler, ages 3 to 6, how can you teach them in the best way? Well, it is really appropriate. Take a doll, let them touch, feel the equipment. Let them see the doll, explain it to them, what's going to go on. Let them see what's going to happen, and they know what's going to go on. And, you know, with preschoolers, Get on their developmental level first so that you can sit down now below them, never stand above these children. Get down on their level, talk to them, break the ice. And these children do listen. They do want to know what's going on. They don't like surprise. A multi. What are some findings from a pediatric physical assessment? Which ones are these are physical? Remember, we have a history physical. That's what RNs do on admission of any patient, adult or child. Physical. Which ones are these are physical? And again, this would be a question that you'd have to read, okay? So growth, the body systems, the lungs, the abdomen, pulses, etc. And of course, any vital sign. Family history, that is a history. It is not a physical. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Remember, toddlers are these me, mine. They don't like people. They're scared, especially those who put pain on them, right? So what do? You're going to utilize play. I will say, you've got such big, beautiful blue eyes. Or I always had stickers as a nurse in the emergency room. And I would get the stickers out and we'd play. Or they have a shirt on. What princess is that? And these children, now I am not threatening. I'm sort of a friend. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? What is that? And that's pain. It's absolutely pain. That little chin, and when they're inconsolable, that is pain. It's something that needs to be addressed and they need to be medicated for. Remember, Tylenol only for the first 6 months. Multi-select. Erickson describes infants as trust versus mistrust. What does trust mean? So an infant who trusts knows that when I cry, somebody's coming to get me. They feel secure. They're happier. They're calmer. They know if they cry, mommy or daddy's coming to get them and they're going to get what they want. The mistrust would be when they have to cry too long to get anybody in there, if they even go. A 3-year-old is having an outpatient procedure. How would you help the child be less fearful? Let's read at the beginning of your preschool child. Again, give them a doll, let them look at it, let them touch the equipment. I let them have my stethoscope. I'll let them take my blood pressure. I'll let them push buttons. And let me tell you, a kid who's playing with you is going to let you do everything you need a lot quicker. And it probably took me 3 minutes more to do it. And if I didn't do that, it would have taken me 20 minutes to get what I needed done. So letting them play, let them touch is so much better. A multi. You need to do an assessment on an infant and you walk into the room and the infant is asleep in the mother's arms. What do? The baby's asleep, so cute. When you have an infant asleep, they're not moving, they're not talking. They are at that point where you can listen to their lungs and their heart and really hear it. Come back later? No. And you're not going to let them put the baby down. You'll wake them up. Let the mommy hold them. You know, you've got a perfect child there to listen to. And I do it all the time. So when do you switch formula to whole milk? And we need whole milk. We need the fat. The fat is good for the central nervous system. That's why even an overweight infant would get whole milk. The fat is good for them. And that's that 1 year. Okay? 6 months, they still need iron fortified formula or they need breast milk. 12 months, you can go whole milk. Another multi. When teaching about car seats for a newborn infant. You know, there's so many options about getting car seats, you know. Sometimes you get brand new ones, which are great, you know, but sometimes you don't have that opportunity or the finances to do it. So what do, right? What is the best for the infant? You can get one from a friend that's gently used, less than a year old, absolutely fine. New car seats, great. Again, rear facing, but anything that's older or you don't know the date of it, like a garage sale thing, I wouldn't use it. You don't know if it's safe for your baby. A multi. When and how do you introduce solid foods to infants? Remember, at birth, for the first several months of their life, their GI tract is extremely immature and they don't tolerate food at all. And it will only cause abdominal pain and diarrhea. So at 6 months, one food at a time, waiting 4 to 7 days in between. Very good. Before assessing a 4-year-old child, what techniques would you use to approach this child? Her 4-year-old is understanding. They're more alert. They're more aware of their environment. And this is the one that you would say, wow, you got a Batman shirt on. Like, oh, I got one of those too. I like yours better. Or beautiful blue eyes. Or look at those freckles. Or wow, your sneakers light up. That's really cool. And you know something, a 4-year-old will light up and be your best friend. What technique can be used to examine a toddler? Again, these people don't want anybody. Toddlers are me, mine, mommy, mommy, daddy, daddy. Again, the first thing you do is get down on their level, get on their developmental level so you know how to talk to them. And when you play with them, they're going to open up to you. So use play. Where's your ears? Where's your nose? These kids love to show off. When assessing a healthy child's lymph nodes, what should you expect? Go in for a healthy checkup. The doctor checks everything, all the lymph nodes. What should he feel? Shouldn't feel a darn thing unless he has an infection. So they should be not there. You shouldn't feel them. The only time they get swollen is with infection. Which Erickson stages of developmental levels should be used for a toddler? Erickson, what does he say? Toddlers. Remember Mimi, mine. And then when you look at that, you're able to put it together. Autonomy. Autonomy is about me. I want to be autonomous. I want to do it myself. That is a toddler. So autonomy versus shame and doubt. And shame and doubt is when mommy or daddy don't let them do it. What pain scale would you use on a 3-year-old? And we've talked about FLAC, we've talked about faces, we talked about numeric. Those are the 3 things that usually that you'll see on children. When they turn 3, it becomes faces. Flack is below, it's up to age 3. At preschooler, age 3, it becomes faces. Remember, flack is nonverbal children or under 3 years old. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? Again, you allow children, the infant, the toddler, to do what they want, right? They want to, they're autonomous, but that shame is when mom or dad or whoever says, "Oh, don't do that, you're gonna hurt yourself." A 2-year-old is playing with mud and dirt. What type of play is that? I like when they go outside and they stick their little toes in the mud and it squishes between them and and they put their hands in it. You're like, you just took your bath. What's going on? And you're gonna do it again. And it's called sense pleasure. Just like sand, dirt, water, any of those. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. Is that what an 18-month-old should be doing? Or is there a problem here? Absolutely normal. No, 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 mine, mine, mine. They are absolutely just like that. What is descriptive of a preschooler's understanding of time? Again, it associates time with events. They don't know 2 p.m. in the afternoon. They know after lunch, we are going to whatever. Or in the morning when the sun comes back up, we're going whatever. They don't understand 8 a.m., 9 a.m. They don't get that. A 4-month-old infant is crying, shaking their head. What feature of pain is this infant showing? They're shaking their head and they're quivering their chins and they're clenched and they're just they're miserable. What are they showing you? They're showing you where it's at. It's probably an ear. Sometimes they bang their heads, you'll see it, or the mouth will go down their hand and you know it's their throat. They're showing you location. A 1-month-old infant's back of their head is flat. What would you tell them, mother? Plagiocephaly. What would you tell them? How do you fix it? Can you fix it? Or do we have to go get one of those helmet heads? Well, you might need a helmet head, but just do tummy time. Put them up 1 hour a day is about all they need. Infants crawl before they walk. This pattern of growth and development is called what? So they lift their head, they turn front to back, back to front, get on their knees, they crawl, they sit unsupported, they get up, they creep, they walk. This is all growth and development in the first year of life. What is that called? It's called sequential trends. It's the sequence of the happenings. Now, some children never creep, they go right to walking. Some kids never go crawling, they get right up on their feet. As long as they're going in the forward direction, that's all anybody wants to see. Some skip them. How do you communicate with parents that do not speak a language that you know? You know, I came to Miami back in 1980 and I knew no Spanish. And at the time I did, more adults. And of course, I had these, how do I talk to them? What's the best way? And the telephone interpreter is the best. Now, is there a staff member? They're not always there available for you. The best way is that blue phone thing. And never ask one of the children or an older children that come, because they're going to put in their own opinion on what the mother's saying. You want exactly the feeling that the mother says or father. What age would most children understand under, on top of, beside, and back of, over, under, around? Again, I know my Christian did this a lot earlier than that. So again, don't look at your own children or children Know what the book says. And it's 4 years old. Yes, my Christian did it at 3 years old too. But 4 is the answer, okay? Warning you on that. In terms of language and cognitive development, a 4-year-old would be expected to do what? Cognitive thinking, right? Language, talking and thinking. A 4-year-old should do what? And at this point, a 4-year-old, take your shoes, put them by the front door, get your clothes, put them in the dirty laundry, go get ready for bed. These are things a 4-year-old should know. What pain scale would you use to assess the pain of a toddler? Ages 1 to 3. What are you going to use? And that's your FLAC. Very good. Faces, legs, activity, crying, consolability. That's what FLAC is. Very good. A multi. What safety instructions would you teach the parents of a 6-month-old? What does a 6-month-old do? Safety. And many of your questions are on safety and on infection control. That's what the HESI and your NCLEX love. So rear facing, yes. Cover those electrical outlet, yes. And again, these kids are going to turn over by 6 months old. Don't put them anywhere they can roll on the floor. A multi. What are the cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? And they're unable to understand somebody else. They don't yet. They don't get that. But they use objects to represent other things, like taking a broom and riding it like a horse, or saying, why do a tree have leaves? Is that to protect themselves in case somebody's looking for them? And they're imaginative. That's all part of that. A nurse receives a phone call about a 6-week-old baby and he's crying a lot. What should the nurse do? The mother wants her to tell her to do something. What should she do? 6-week-old baby. Remember, babies are born and they're susceptible to everything. These are children, if you work in an emergency room, 6 weeks old, certain diagnoses, they're red chart, they're flagged and they're come right in. So these children, have them get to the doctor or go to an ER. It could be something more than crying or just colic. It could be other stuff going on. A multi. What should an infant be able to do at 9 months? They should be able to do everything, but sit without support, okay? 8 months old sit without support. You know, you don't have to have things propped around them. They're rolling over and now they're up on their feet, creeping around. And of course, they can hold anything. The first expected fine motor developmental milestone for an infant begins with, remember, F is all about the fingers. What do they do first? What do they do for mommy? It's what we call a reflex palmar grasp. It's a reflex, and then it becomes voluntary. Remember, F fingers first is reflex. A toddler's parent asks the nurse for suggestions on dealing with temper tantrums. What do? How the hell you know this one? Walk away quick, right? Get earplugs. Do you have children? Okay, I can understand how that could be something. Again, ignore it as long as it's not injurious. Again, if you continue to go to those temper tantrums, that's how they're going to get your attention, and you don't want that. A 2-year-old has difficulty in activities, sensory sensitivity, only speaks 1 word. How are you going to assess what's going on here? And as we go on, you're going to hear, you know, different conditions in children and, you know, what to do. A 2-year-old should be able to speak a lot more. They should be able to, you know, be able to touch and feel and see things. This is probably an autistic child. And there are checklists for it. There's a Denver screening tool, which can show you there's needs for more sort of interventions with it. And we'll get onto that as we get into another section. Parents are concerned their 8-month-old is not developing like their older child. What's normal for 8 months? What did I tell you? 8 months old, what can they do? Start with a reflex, then we come voluntary, then we come crude pincer, regular pincer. That's all your fine motors, right? Then we get into the gross motors. By 8 months, they should sit unsupported. Not every child will, though. Remember, all kids are different. What fine motor skill is expected of a 4-year-old? Fine motor, fingers. And that's buttoning a shirt. Skipping is gross motor, tying shoelaces, that's later on. Walk up and down stairs again, gross motor. You wanted fine motor. A multi. What gross motor skills should a 4-year-old be able to do? Get up and go, go, go. Now this is movement. So again, with a lot of these questions in children, in pediatrics, read the question. What is it looking for? It could be opposite of what you think. They should be able to walk upstairs using every other feet. They can hop on 1 or 2 feet. Tying shoelaces is fine motor, and jumping rope is not yet. That's about 6. RN doing a developmental screening on a 10-month-old should expect which fine motor skills? Remember, fingers. Start with a grasp, then we go to pincer, then we go to taking things in and out of containers or building a block. That's the first year of fine motor. So at 10 months, what is it? It's probably a crude grasp. I mean, you are beyond, you're not a pincer grasp completely yet. You're more crude, and now you're going to probably be able to almost put them into the container, but you're going to grab stuff and you're going to, it's more of a crude pincer, but it is a pincer. Frequent developmental assessments are important for what reason? What would you do if a kid wasn't turning over both ways by 6 months old? There's something going on, right? And what does that mean? Why do we do these things? And you know what's great about children? We start early intervention and these kids catch up really quickly. Kids are amazing. It shows there's delays. And then what do? Early intervention, and it works. A multi. An infant searches for her toy that's not in sight. What is that called? The 1-year-old goes to bed, wakes up in the morning, says, ha, I know, goes to the toy box and grabs it. And that's what we call object permanence. It tells you that they're memorizing, they know what's going on. And again, this is a child searching for it themselves, exploration, which are all great things for cognition. The natural physical developmental sequence that most children follow is what? This is all your gross stuff that they do from birth to 1-year-old. And if they're not doing it all, does it mean they're delayed? Well, if they're not walking by 12 months, it doesn't mean they're delayed as long as they've done everything else. So they lift their head. That's always number one, okay? Roll over, crawl, cruise, and then they walk. Good. A multi. Which would alert the nurse to hold digoxin on an infant she's caring for? Well, what do you know about digoxin? Think about pharmacology in adults, because that's what you learned on. You know, you count an apical pulse for 1 minute. What is normal heart rate for an infant? That's what this question is looking at. And then it's the other stuff too. Heart rate of 90 is too low. Digoxin level is too high. And then potassium level must be normal or you go into dig toxicity. In general, an infant should triple their birth weight at what months of age? And that's at 12 months. We double at 6 months, we triple at 12 months. Very good. When an infant toes spread, when the soles of the feet are stroked, what's it called with adults? Same thing. This is one that is, whether it's adult or children, it's the same. This is your Babinski. Rooting is when you stroke his cheek and they look for food. Startle is when you noise or you hit a crib and they and their hands come up, okay? And you already know grasping. How do you prevent otitis media in infants? Think about where the eustachian tubes are. Right? They're in the back of the throat to go up. Short, open, straight tubes. So it's smoke is the big thing. And then they also say have them sitting up after feeds, but smoke is a big thing with otitis. When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What reflex is that one? I gave you one name. This is the other name for that reflex. It's called Moro. Moro or startle are the same thing. Very good. A 4-year-old's reluctant to take medicine. What intervention should the nurse take? If you ever worked in an emergency room and you get these young kids and you got to give them medicine, sometimes it could be quite a project. Now, this is what the book says to do. It does help a little. And it's basically use a straightforward approach. Never, ever put it in food or in juice. Or in the bottle? Did they drink it all? Did they eat it all? You don't know how much medicine they took. So just say, do you want a pill or do you want liquid? Would you like it in a cup? Would you like it in a syringe? Straightforward. Do you want this or this? Don't give them, in the medicine or food. They won't drink it all and you don't know if they got it. Which intervention helps a hospitalized toddler? Feels a sense of control. What do toddlers like in their normal life? What keeps them happy and content and stress-free? And that's routine. And you can somewhat maintain that in a hospital. Very good. A 3-month-old infant doesn't sleep through the night. What finding is most significant? What did I tell you about infants not sleeping? One of the things that you have to prevent, because this is going to keep you awake all night. And as I said, it could be the type of diapers, and that's the diaper rash. Very good. An RN assessing a 2.5-year-old toddler. What findings should you report to the provider? Which one of these is not correct? I mentioned it about 3 times tonight. Remember, the head is big at birth. It should about 1.5 years at least equal the chest or be smaller than. If it's bigger, you need to find out why. Is it hydrocephalus? What's going on? A multi. What are risk factors for SIDS? Sudden infant death syndrome. Sleeping on their abdomens. What causes SIDS or more chance of? Males, smoke, and what if they were just sick? They got a plugged up nose. Breastfeeding stops the risk factor. You have decreased chance of SIDS with breastfeeding. What does the rooting reflex enable the infant to do? That rooting. It's why you stroke their cheeks, especially the young kids, as a nurse. And that's, they're hungry. I'm going to feed you now, whether it's breast or bottle. A multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, you're going to see about 4 different type of ABG type of questions on your HESI. So I'm going to give you some of these. If you are having diarrhea, you're getting rid of all of your alkaline. What are you left with? Which is acidosis, all right? Because all of your digestive materials are alkaline. So you're having diarrhea, you're getting rid of it. You're left with acid. But then, of course, any loss of a lot of liquid, hypokalemia, okay? So you're going to be hearing these through all of my cahoots to try to help you understand better. Normal language skills for a 3-year-old child. How should they be able to talk? They're about 4-word sentences at this time, okay? 1 to 2, that is your toddlers. But you get to your preschoolers, it's a lot more. An infant's unable to take a breast or bottle for feedings. What's important to remember? You know, many times you have these diagnoses where children can't eat. They're not allowed, but you know, you got to remember infants still have to perform certain things. For instance, what about how do they soothe themselves? How do they decrease stress? You know, eventually they're going to be able to eat. It's all about the pacifier. Give them a pacifier, a non-nutritive sucking device, and they can self-soothe. It'll be a happier baby. And last question. What does an infant start to do at 3 months? By 2 months, they're lifting their head. Then what do they do? And they're rolling over. Usually by that time, it's front to back. They say 5, 6 months. You know, all kids are different. So good job, guys. We made it. Amy, good job, Amy. Number 2, adios. And number 1, doop, 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 doop. Good night. Good job, guys. Number 4, Anna and V. So, did you enjoy your Kahoots tonight? Do you see how I emphasize certain stuff? I get you thinking immediately. And I think that does help in the long run, re-emphasizing it right after we do it. Class is over. Anybody has any questions? Always be okay to ask me. Remember, quiz 2 next week. And you have another discussion question. It's been a pleasure. Anything?
Professor,
Message me. Yes.
when is our first exam?